All right, Anjalee, stay with us because we want to continue talking about this hospital struggling with the brutal trio of RSV, flu, and COVID. COVID cases are increasing so much so that the government is issuing free COVID tests again. To discuss all of this, we want to bring in Dr. Calvin Sun, attending physician in emergency medicine and author of the Monsoon Diaries. Dr. Sun, it's great to have you again. It's been a while since we spoke, which is actually good news just in terms of where we were in the pandemic. But give us a sense of where we are today with COVID cases rising and the fact that we are seeing RSV and flu cases on the upswing as well.
We used to say Christmas came early this year, but in our case, flu season came a month earlier. And I think what we didn't expect was how RSV and COVID came with that. And what we're dealing with right now is a supply issue, not only like the medicines that we have available for people, but also the testing, what to test for. I think our resources have been strapped in every year. I think we get deja vu when we enter on this holiday season. And you got travel season, you got the holidays coming up, so even more of a chance to have these rates increase higher. So this is nothing new. We've been through this, but at the same time, it is a little overwhelming when you had not only just flu, but COVID and RSV. When the kids get sick, the parents need to take care of those kids, and they get more tired, and they're more likely to get sick.
That's right, Dr. Sun. Anjalee here. I know that to help combat this, the White House has come up with a plan, specifically with the addition of reopening the test to send home. They're also talking about partnering with the local government leaders as well as health systems. Federal personnel and resources are being deployed, monitoring those subvariants. We know now the dominance of BQ1 and BQ11, and then specifically focusing on the more vulnerable population. So it seems like that kind of encompasses the right tone. It strikes the right tone in sort of what to watch. But what's the reality on the ground? Do you see the resources being deployed? Do you see, with the rise in cases, that tracking?
We have to test for both flu and COVID when people come into our emergency rooms or urgent care centers. RSV is a little trickier. We usually reserve that for pediatric populations. But when the symptoms are very similar, we should test for both. And what happens is that we end up running out of flu tests and COVID tests. So having these at-home tests being given to Americans around the country does take off a little pressure from our emergency rooms and urgent care centers to having tests, because they don't have to come to us anymore. They can just check at home. And those tests are just as good as the ones that you find in, rapid tests, at least, the ones that you see in hospitals and urgent care centers. So it does save you a trip and saves you from catching another virus in a healthcare facility. Where do you think all those people with symptoms are going to go when they want to check if they have the flu or COVID? They're going to come to us. And when you're not as sick, but you may be thinking that tickle in your throat could be one of those viruses, you end up catching that party favor you never asked for by coming to us, when you could have saved that risk by testing at home.
Good to see you, Doc. The White House says COVID cases are up 90%, which is staggering considering no one I know is even testing. So to hear that number is surprising. And COVID fatigue isn't just setting in, it is baked in. Do you get any sense of how well prepared we are for a winter surge in terms of boosters?
I think that with the bivalent boosters that we have, it's been very tremendous in lowering the hospitalization rates. Just like seatbelts don't prevent car accidents, but the availability of flu shots, I know that this year's flu shot has been really good and reducing hospitalization rates from countries who had their flu seasons earlier than ours. So we're very confident that, those who get the bivalent booster and the flu shot, I got mine both at the same time, and now I'm doing great. That was just 2 months ago. And I haven't gotten sick, even though I'm constantly exposed to people who are sick and have symptoms. I haven't gotten it yet. And if I were, I know that the severity would be lessened to the point where I don't have to worry and I will end up in the hospitals. And those that 90% or whatever statistics you hear, those are the people who are testing, but really it's also the people who are being tested. So those who are not testing, there may be even greater, but the figures that they get sent are those that are being tested because they're presenting with illness. They are being hospitalized or admitted to the hospital, and they have to get tested with COVID or flu, so they get cohorted to the right places. So those are the ones that are sick enough to get tested in the first place.
So, Dr. Sun, where does this leave us on masking? Because at a time when we haven't really had mask mandates for quite some time, we're hearing more and more about the fact that we should be masking. So what would you tell patients in terms of when they should be wearing a mask right now and when they don't have to worry about it?
obviously, we live in a country where if you're being told what to do, you may get a backlash and a worse outcome when people, out of defiance or pride or fear, do the opposite of what you would recommend. So there's a way of communicating of how I like to approach it is like with vaccines and masks. No one's forcing you or looking over your shoulder or arresting you or doing whatever, that you're afraid they might be doing to you if you don't do something. It's on your conscience. There are consequences. And if grandma gets sick and dies because you got her sick because you refused to mask around her out of pride or fear, whatever it is, or you decide not to get vaccinated when you visit your family and get, grandpa's sick and they're in the hospital later on, those are vulnerable populations. That's on your conscience, and you have to accept those consequences as because it was because you didn't do something that you could have. If you decided not to put on a seatbelt, there are consequences when bad things happen, and you have to own that consequence. And people hear it this way, they do consider it a little more seriously. And if that, tips the needle a little bit, it does make a huge difference.
Dr. Sun, I know there was a recent report looking at the immune evasiveness of the new variants compared to the boosters, as well as now we know there are no antibody treatments. I wonder, there's a lot of focus on the case rise, but can you give us a little context about the hospitalization and those who are contracting severe disease? What do you see in terms of who is actually still contracting this disease at a severe level?
It's the vulnerable populations, immunocompromised, the elderly, and the very young. I mean, we've said this before. It's been like, 3 to 4 years since most of us been vaccinated, and most of us are fine. There's an adult population, but the ones that need constant boosters, the ones that need the bivalent vaccine, the ones that are urged to vaccinate earlier, all the vulnerable populations, because they're the most likely to get hospitalized and overwhelm the hospital system. We don't want it to collapse because once we run out of beds, where are people going to go? People are concerned because the vaccine doesn't prevent all illness. Well, seatbelts don't prevent all car accidents. Bulletproof vests don't prevent getting shot. Helmets don't prevent a brick falling on your head. But it does reduce the possibility, the chances that you're going to end up in the hospital and taking up an otherwise unnecessary bed. And the vulnerable populations are more likely, just by a baseline, without even getting sick, to take up a hospital bed because they're vulnerable. And therefore, when you get them something like a tridemic or tripledemic and the holiday season and everyone's staying indoors and families are getting together, that's the perfect storm for them to increase the hospitalization rate at an exponential rate when the season happens. And that's what we're seeing right now.
All right, got to leave it there. Dr. Calvin's son, Anjalee Khemlani, thanks so much, both of you, for being with us.